Hello, welcome to a conversation about Boquete Health and Hospice with our administrator, Bev Tyler, and the president, myself, Lesley Hughes. Bev, how did hospice get started? What was its impetus? And why do you find it interesting to work here?
Boquete Health and Hospice started about 12 years ago with 4 expats from the U.S. who had done many years of hospice visiting and had found it very satisfying and realized that there was a need for something like that in Boquete and were determined to make it happen. They did a lot of research with hospices in the United States and got policies and procedures from them and did what they could to adapt them to the situation here in Boquete. I found out about it strictly by word of mouth. I learned that there was going to be a training, the very first training. It was a 3-day training, which is what we still do. And they were encouraging people to go who had relevant experience. So we had nurses, therapists, counselors, educators. There was even one lawyer. One of the original 4 people was a lawyer. And so it was a very interesting training. People would get up out of the audience and go and teach a section and then go back and be students again for the rest of the time. And I found it absolutely fascinating. I was very new here and didn't know much about the community or what services existed, but I knew it was something I wanted to be part of. Shortly after the training, they decided that they needed to have a specific person to carry the hospice phone. We don't have a location, we have a phone, and so our interface with the community is through the phone. I was a nurse for many years and worked with young adults who had a fatal anemia, and before that in emergency. So I was dealing with people in crisis situations in their lives and really enjoyed supporting people in that kind of situation. It was very satisfying for me, and so working with Boquete Health and Hospice now gives me an opportunity to continue that work. We started out helping just English-speaking people, and that was really because we had a whole lot of work to do at the beginning, trying to sort out how we were going to go about doing things, learning about the healthcare system in Panama that would affect our patients here in Boquete. We needed to know about death and dying in Panama, what you do with when someone dies in Boquete, all of that. And it was just more than we could do to work in Spanish at the same time. So for the first year, we didn't. We were just strictly English. But since then, and even in the second year, we got Spanish-speaking volunteers. We expanded what we were able to do, and we now service about half of what we do is in Spanish. So we're very proud of that, and I believe that we really are supporting the Panamanian community, particularly in loan of equipment, but it's a really valuable service, and we do everything we can to support the whole community, both English-speaking and Spanish.
What do you do when someone calls and speaks Spanish and you've got someone on the answering the phone that doesn't speak Spanish? How do you get that need understood?
Well, we have a translation team. I work very hard on my Spanish so that I can handle questions in Spanish as long as they don't talk too fast. But we have a really wonderful translation team now. So we just say to the person that they're going to get a call back from somebody who speaks Spanish, and then one of our translator team will call them. And we've had people calling from Colombia to translate for us. It's just great. And over the years, we've got more volunteers who they may not be fluent in Spanish, but they have enough Spanish to visit a patient or handle a simple phone call. So it's really improved.
Sounds like you find it a very rewarding experience.
Very, yes. To be actually helping people who really need it. It's not what we've decided they need, it's things that they have asked for. And we can provide concrete help, and some of the time in their own language. Well, all the time in their own language. It's just sometimes that language is English, but but we are able to provide it in their own language. So Lesley, how did you get involved?
Well, when we moved to Panama a couple of years ago, I came down here with an EMT, an emergency medical technician certification from New York State. And I really enjoyed being an EMT. It gave me the opportunity to help people when they needed it, not when I thought they needed it, similar to what you were just saying. And I searched for an opportunity with various organizations in Boquete, and hospice seemed to meet a couple of requirements. I wanted something where I could, get involved with people, but I also wanted something where I felt my skills could be used. And I was almost immediately assigned to the respiratory team, and that gave me the opportunity to go out and visit patients, provide oxygen concentrators to them, improve their quality of life, and make them feel better, all of which I felt were, very important to my well-being here in town. And it was a very interesting thing that grew from there. Because of my medical background, I was tapped to become the interim administrator for a few months last summer. And that took everything to a whole new level in that I was dealing with people who needed equipment. I was dealing with people who needed a home visit. I was dealing with people who, at the very worst time of their life, their partner had died. And it gave me a chance to embrace the entire philosophy of hospice. So it was a wonderful thing, and from there I got tapped to be president. So again, I'm serving the organization in a third capacity, and it gives me a whole different feeling for taking people when they need something and providing it, whether it's a material thing like a pair of crutches or a hospital bed, whether it's a shoulder to cry on. It doesn't matter. We're here to help people. And that's the one thing I've found about all of our members, whether they're involved with taking care of patients or not, they all want to help. And they do an absolutely incredible job on that. Moving on a little bit, what are the programs for the health services that we offer that you as administrator oversee?
When we started, we were Boquete Hospice, because hospice was the thing we did. And of course we still do, and it's certainly my number one priority. We go into homes. First I go in and do an assessment of the situation and find out what they need and what they want, what expectations they have of us. And then we take it from there. We may have a team go in and support the caregiver. They have to have someone who is taking care of them. Usually that's going to be a family member. It may not be. And we focus our attention around the patient as long as we can, and then the caregiver when the patient is no longer able to direct what they want to have happen. So we may be doing things like errands that the caregiver can't do because they're busy taking care of their loved one. But we just do, within reason, we do whatever needs doing in the home in order to support those people through this process. We also provide information about death and dying in Panama, and it's very different what they may have experienced in their home country if they're expats. And there's a lot of work involved in getting that information about funeral homes, about what forms are needed, what government offices, all of that kind of thing. Something that you don't want to have to be doing at a time when your loved one is dying. And so we can easily provide that information. So so we were Boquete Hospice. Well, then we decided that there was also a real need for what we call health support. And there, again, we were looking at expats with this mainly because there are a lot of expats who come here either alone or with a partner. And if they have an accident or sudden illness, that partner may not be able to take care of them. So we limit to a short term. If someone, say, has fallen and broken their hip and they may be at home recovering, we might go in for 2 weeks or possibly extend it to 4 weeks. We would loan equipment. We might have someone in the home just there as support so that they could go and have a shower knowing that they're not alone in their house. We might provide meals, various things. We might pick up prescriptions, but for a limited time period. We also do what we call respite care, and that's really the only thing we do for people with chronic illnesses. Because our equipment loan, our volunteer visits, everything we do has to be short term, otherwise we would just loan out all our equipment forever and never have any more to help other people. So, but in this case, the patient will have someone who is taking care of them already, but that person needs a break. And so we might go in for 2 to 4 weeks and do visits and give respite to that person. Our biggest program, and the one that we spend most of our time and attention on, just because it's what the community requests, is equipment loan. We have a wide variety of equipment. It is a very rare occasion when someone calls and asks for something that we simply don't have. And that's because historically, when people would call and ask for a piece of equipment, we didn't have it, we'd get it, so that we do have it. Now, people will call and ask for something and we have it out on loan and we don't have it available. That does happen. But it's really impressive that we have hospital beds, wheelchairs, walkers, crutches, bedside commodes, a wide variety of things, oxygen concentrators. We have disposable items that we don't buy necessarily, but people will donate to us. And so we really fulfill a great need in our community for people who are sick. And that is the main way that we serve the Panamanian community. We find that regarding hospice and health support, Panamanians have big families, and most of the things we do, they don't need. We are absolutely available, though, to provide care for any of the services that we provide. We will provide to Panamanians, mainly in Spanish. We certainly have done that. One instance where the caregiver didn't speak English, so we had someone on a cell phone who was available to translate. Whenever one of our volunteers came into the home and needed to talk to the caregiver, the patient spoke English, but the caregiver did not. So they would call the person and get a translation. I mean, now we have enough Spanish-speaking volunteers, we probably don't have to do that, but our services absolutely extend to the Panamanian community. As President, Lesley, can you explain what other programs we have that are not necessarily directly patient care? Because a lot of new things have happened in the last year or so.
Over the last couple of years, we've expanded what we can do for the community by leaps and bounds. One that's been going on longest is the Healthy Living series. We regularly at the BCP at Tuesday mornings will do a presentation on something that can make life easier for the community. For example, we've done presentations on diabetes, how to recognize it and what to do if someone goes into a diabetic crisis. Fall prevention, how to look at the house and make sure that it's safe so that, you get up in the middle of the night, you're not going to end up falling downstairs and breaking a hip. We've done things that will give information so that hopefully the community won't need the services that you provide. We do things and provide classes. We have started last year a CPR course called cardiopulmonary resuscitation, which works to help people who've had a heart attack and are dying, and it's going to take a while for the ambulance to get there. So someone who knows CPR can administer it and provide life-sustaining care until the ambulance arrives. We provide CPR classes in English and in Spanish. We usually do one every month. And now we're being asked by various restaurants and hotels in town to train their staff. The more people who know it, the better chances of survival are going to be. The second thing we started last year was our blood donor program. Up until last year, there was no actual blood bank in Cherokee. So a group of hospice members decided to take matters into their own hands. They contacted the director of Hospital Regional And she came and she talked with what was needed. And last June, they had the first blood drive. And in October, we had a second blood drive. We collected over 100 pints of blood. We have now provided 45 people with blood since last June. And these are life-sustaining events. These people could have died. The problem with what was happening beforehand was it was a social media news bulletin that went out. Someone needs blood. Okay, if someone needed blood, I get in my car, I drive down to Hospital Regional. I fill out the paperwork, they test my blood, I sit while they tested it. Then they decide it was good blood, they take it, and I'd still have to fill out more paperwork and drive home. It was an 8-hour process. Now, someone from the Boquete area needs blood. Their doctor calls the director of blood services at Hospital Regional, and sometimes within an hour, that blood is being given to the patient. That's a 7-hour time savings. That's life-saving. So what we've done there is absolutely huge. And what we're planning is every June and October going forward to have more blood drives. Then the last thing we've done is, it's called Being Prepared, which is actually an informational series on how to handle a death in Panama. There's a specific order of things that have to occur in a specific sequence. You call your doctor, you then go to the tribunal, you then do this, you then do that, and eventually everything gets done. Without knowing the proper steps, things can get held up and it can be very stressful to the family. So what we've done is this last year, our Being Prepared team has edited, updated, reviewed, and confirmed all of the information that's in the booklet. And it's being printed as we speak, and it will be available on a quarterly basis. We're going to be doing quarterly presentations at the BCP or at the Animalis building. And this is information that every expat in Boquete needs to know, because either you, your partner, or a neighbor, you're probably going to run into a death at some point, and knowing what to do can make a terrible situation slightly less terrible. So we've got lots of new things going on. We've got a lot of our health service programs going. We've got new initiatives going, and Boquete Health and Hospice is growing and becoming a much more important part of the community. Bev, thank you for coming by and talking about Boquete Health and Hospice, and what the health services does and what our new initiatives are doing. And I hope this will be useful to everyone who's watching this video.